This episode of the Senior Rehab Podcast is sponsored by the Academy of Geriatric Physical Therapy. AGPT's mission is to further your ability to provide best practice physical therapy and to advocate for optimal aging. How do they do this? Well, one way is by connecting like-minded individuals around a specific topic. We call these special interest groups, or SIGs. One SIG is a health promotion and wellness special interest group. I highly encourage y'all to check out some of the work they've done, especially with their presentation on physical activity, a key to successful aging. You can access this presentation for free and learn about how the AGPT can further your clinical practice at geriatricspt.org/SRP. Hit me!
This is a Senior Rehab Podcast, the podcast for rehab clinicians that want to better serve older adults.
Welcome to the State of the SNF. I'm your host, Nicole, and this month I sat down with some of my coworkers to discuss certifications in the skilled nursing rehab setting. Are they worth your time, money, energy, and what good do they even do for your patients? I think you guys will enjoy this one. So if the SNF setting is, not something for skill, then why would you bother learning extra things and paying this money and taking this time? So I sat down with two people that I work with, and we talked about it. So guys, introduce yourselves.
Hi, my name is Will Ballinger, PT, DPT.
My name is Grace Steinhira. I'm a physical therapist.
How long have you guys been working in geriatrics?
I've been working in the geriatric setting for a little over 18 years.
Okay.
I've been working in the geriatric setting for about a little over a year and a half.
All right, so did you guys work anywhere else before this? And if so, what kind of setting was it?
I've worked in various settings, did some outpatient for a couple of years, acute care setting, and subacute.
Okay. And Will?
Just through my clinical rotations, so the usual outpatient, acute, and pediatrics, but currently I am also doing home care.
Okay, so tell me a little bit about what drew you to geriatrics.
I think it just kind of drew me towards it. I think I have to put it that way, because when I moved to New Jersey, it just so happened the outpatient clinic that I had started out in was generally near a lot of senior living communities.
I think that's all we have here.
Right? So, majority of our clients were geriatrics. I just got like the occasional sprinkle of 40-year-olds and younger.
How about you, Will?
So being fresh out of graduate school, I decided to go towards the geriatric population because I think it can be a challenge because you have different variations of the geriatric population. So you can have the motivated ones, you can have the unmotivated ones, and then you can also show the people that have these debilitating either diseases or just going through a rough period of time with, say, a fall and a hip fracture, that they can still function at an independent level.
So what you're saying is not everyone does old the same.
No. Yes, exactly. Yeah, not everybody does old the same.
Not everyone does old the same. I hear what you're saying, Grace. I feel like it just kind of sucked me in.
Yes.
Even when I was an outpatient, I felt myself being sucked into the older adults again.
And I mean, if you really think about it too, there are only two populations that are generally falling sick and needing to get better. It's either you go to the other side of the spectrum and it's really, really young, or it's much, much older.
Yeah. I could not do really, really young.
Yeah.
You both have certification in LSVT?
Yes.
Yes.
So what made you, and jump in whoever wants to talk, what made you decide to get the LSVT certification?
So my initial interest in the LSVT certification and everything started when I was on my clinical rotation in an outpatient setting. We had a patient that came in with Parkinson's, and my CI actually had me do research over the weekend to find out what type of interventions we can do to progress it, and that's where I came across the LSVT program and the protocols. So we implemented it into his, but not being the actual LSVT protocol because you needed the certification, but the high amplitude movements and just putting that in there. So after seeing his progression, I decided to dive into it a little bit more, and also I ended up doing a research project in grad school with LSVT.
I see Grace nodding. What are you
pretty
thinking?
neat. Well, it's funny how he mentioned how he happened upon it while he was doing his clinicals, because that's kind of the same way it happened for me. I was working with a patient. He was like, I want to say he was like maybe early 70s, previously high functioning, new diagnosis of Parkinson's, and wanted to go back to living on his own. And I was trying to problem solve and get really creative with his exercise program. So I went online and I'm searching for something that would suit him. And then I just happened upon, it was an illustrated copy of some of the standing exercises. Mm-hmm. And I just followed the instructions, tried them out on him. It worked, surprisingly. When I did repeat Berg balance scores on him, he scored it was a huge jump. Like 15 or 20 points is how much he jumped. And got him using a device, independent, back to home. And I was like, you know what, maybe this is worth looking into. So I looked into doing the actual program. And I mean, you see the results.
Yeah. I actually saw... I don't think I saw you doing it, but I also learned about it from Janine, one of our speech therapists who used to be here. I saw her doing the loud portions of it, mm-hmm. and then she told me there was the big portion, and then I saw you doing it. Mm-hmm. So I don't have the certification, but it is something I'd be interested in, I think, in the future. It seems to be very useful in this setting, and I could see how it would fit in with other settings mm-hmm. as well.
Yeah, not only just using the certification and the protocol that's behind it, but taking the theory behind LSVT into the SNF program, because we deal with a lot of people that aren't diagnosed specifically with Parkinsonism or Parkinson's disease precisely, but they do present with shuffling gait pattern, dysfunctions with gait overall, that doing sort of the high amplitude training has improve their function and also improve their balance along with their gait sequence.
So what's the certification like for the LSVT?
How to get it?
Yeah, how to get it.
It's
I did a weekend program. Yeah. I did a 2-day hands-on. I went to the one that was being offered in New York, and there was a lot of hands-on. There was a lecture portion as well. There was demonstration, repeat demonstration, and then for the recertification part, I think it's every 2 years? Every 2 years, and you have to meet certain continuing ed requirements in order to renew.
Do you ever have to resit for the certification, or as long as you keep the continuing ed, you're good?
I think so long as you do the continuing ed, you should be fine. Yeah. Also, I'm just going to add on to what Will was saying earlier about the application of the program, and what's nice about it is the fact that they have actually modified a lot of the exercises. So if you have a patient who can only do the exercises seated or can only do them in supine, they've actually modified a lot of the exercises, so you can modify it according to what your patient needs are.
Oh, that's really helpful.
Yeah.
That's a good step. When did they do that? How long has that modification been available?
About a year or 2 years, maybe?
Years now.
Yeah.
Okay. That's good to know, because some of our patients, standing is the high end of the spectrum for them.
Yes.
But they could definitely use some of these things.
Yes.
Especially if you're applying it a little more broadly, like we've been saying. So do you feel like it was worth the investment of time and money to get this certification?
Oh, definitely. You can never have too many tools under your belt.
Yeah, I'm going to say the same thing. It's always good to have something else in your toolbox.
Yeah, and Will, I've seen you most recently with somebody, and mm-hmm. he looks awesome.
Yeah, he actually, like Grace was saying, I started him at the modified sitting, and now we've progressed. We're on week 3, and we've progressed to the standing activities last week. So he's doing well.
Yeah.
And he's also able to walk without an assistive device with contact guard.
Which, when I saw, was, considering where he was before that, and then to see him after, 2 weeks start walking like that, that was amazing. I was floored. That was really cool. So now, Grace, I know you have a couple other certifications, and I'd like to talk about those too as well. Do you have anything else to add about the LSVT, or other than you think people should get it, well worth the time and energy and money for the setting, or pretty much any setting?
Any setting, yeah. Well, unless you're pediatric. Pediatric, I don't really know if it's going to be worth it there, but any other setting, outpatient, acute, SNF, they're all worth it.
I agree.
All right, Grace, let's talk about your other certifications then. The NDT and lymphedema certifications. Why did you choose those two in particular?
Well, the lymphedema management I decided to do, we're talking 15 years ago, and I was just looking for something to further my education. At the time, we were starting to see a handful of cancer patients, and it just seemed right. Nobody else was doing it in the facility, so I decided to take the 2 weeks, do the certification, and I mean, it's come in handy.
Where did you have to go for was it when you had to travel for?
I went to the one in Red Bank.
Okay. So it was
Norton School
Norton
of
School.
Lymphedema.
So it was 2 weeks solid that you had
It was 2 weeks solid, yeah.
Oh,
And it was with a lot of other therapists who, a lot of them were from Sloan Kettering. We had a couple from the West Coast. It was, yeah.
Oh, wow.
It was a pretty intense 2 weeks, but definitely a lot of hands-on, so it's definitely something that you retain because of all the
So we don't have as many
training.
cancer patients now, but do you feel like you're still using it? Like, do you feel like it's still a good skill to have in a general setting?
I think it's always good to have as much education as possible going into any setting, whether it be NDT, lymphedema, LSVT. I feel that the more educated you are, the more sensitive your hands can be when you're handling patients, the more you can help your patients.
Okay. And would you say, too, like, the more skills you have in your background, the more you can apply to every patient?
Yes.
Just kind of
Yes.
helps you see things outside the box
Yes.
almost?
The more tools you have, the better.
Okay.
Yeah.
So tell me a little about the NDT certification.
Now, with regards to the NDT certification, I was just looking for something to really invest in.
Okay.
And we were seeing a lot of stroke patients, and, you try to learn off of other therapists, but you also want to further your education as well. And I felt, you know what, in order for me to be a little bit more sensitive handling my patients and further my knowledge, I figured what better way to do that than invest 2 weeks into a certification. So I did the NDT certification, this was 8 years ago.
Okay.
And I mean, another solid 2 weeks of training that I feel are definitely worth it. I mean, and you don't just limit it to your neuro patients. Because of the techniques they give you or equip you with to handle your patients, I feel that you can apply it to any case.
So you feel like you're using a lot of the NDT, or at least some of the NDT stuff,
Yes.
on other patients who would not be like a classic neurological case?
Yes, yes.
Tell me about, now, do you have to go get recertified for these? What is it like to try to hold these certifications? What do you have to do yearly? What do you have to do for recertification?
With regards to recertification, a lot of times they'll give you, let's say, the option for a 2, 3, or 4 year certification, and then you have to fulfill continuing education requirements in order to keep your certification.
Are these on top of what you use for your license? Because we have to have license requirements
Yes.
too here. So this is on top of. Can they be applied to it, or are they just?
Sometimes you can apply your continuing ed to it. Like with regards to the NDT certification, they're actually kind of specific. They want you to do like specifically 10 units towards any neurological education.
Okay.
But they don't want anything to be too repetitive. So,
Okay.
so they'll actually specify on the site as you're doing your research what exactly they're looking for.
Okay.
And they have to approve it before they can give you your.
So you have to submit it to the NDT people,
Yeah,
and then
yeah.
they say
Yes.
if you can even take it.
Yes. But they're also very helpful too. Like on their website, they'll actually have some recommended courses that you can take, which is helpful.
Okay.
Yeah.
And what about for lymphedema? Same thing?
For the lymphedema, actually, I have the option of doing like a refresher.
Okay.
They're actually becoming quite flexible with regards to continuing education in that area, wherein you can actually do some of the stuff online now, which is great.
Yeah.
It makes it more attainable to, a lot of therapists who don't have the time to actually sit down and invest.
Yeah, because I was going to say, do you have to travel again for those certifications? Like,
No, I don't
Okay.
have to travel, which is good.
because you were saying the NDT, the lymphedema you did locally, but the NDT you were just telling me you had to travel for?
Yes. I mean, you have, depending on where you live, and if you're lucky enough to get a slot, could do it locally. It's just a matter of how often they offer it in the area that you.
Okay.
that you live in. Yeah.
Okay. So what would you say to somebody who's thinking about getting certifications? So one of the things we try to combat here is the idea that home health and the skilled nursing are fields where therapists go to die. Like that whole mindset that like we're like on our way out and there's no skill needed here. But clearly you have like a whole bunch of skills under your belt. So what would you say to somebody who's like, what can I do to show the fact that I have these skills? Like, what can I do? Is it worth my time in this setting?
I think it's just a matter of finding what fits best for you. Like for me, I like being able to go out and learn something that I know would provide substantial improvement in my patients. And for me, I like to learn using my hands. I need to actually, learn off of somebody in order for me to obtain a new skill and know that I'm doing it correctly. Other people, they may learn differently. They may learn more, in other ways from doing research or, I find this is what works best for me. I definitely do not feel that geriatrics is a place where therapists go to die. If anything, I feel that it's where we're needed the most, because if we don't help them, who is? Who's going to invest the time or the skills to help these people? Because at some point in time, you got to remember, we are getting old, our parents are getting old, our siblings are getting old, and you want to know that there are people out there who have the skills to help us, to help them. Because if it isn't going to be us, who is it going to be, really?
Ah, Grace, we love you. See, and this is why I love Grace. Since we recorded this conversation, Grace has texted me something she wished she had answered better in conversation, and she said this: contrary to what others believe about subacute rehab, it's through working in this population that our creative juices are really challenged to flow, and therapists need to start thinking outside the box, given multiple comorbidities and face problematic discharges. Instead of going here to die, we are really catching our second wind, given that we are more seasoned and better equipped to treat this special population through our DPT's research, certification, and clinical experience. We develop a new determination to enhance patient outcomes and quality of life in the aging population. Quoting your group, old does not equal weak. And I hope some of you are inspired to seek out new certifications and new skills to better serve your older adults. Thanks again for listening.
Hit me! Thank you for listening to the Senior Rehab Podcast. If you only listen to these podcast episodes, you are missing out on 90% of the Senior Rehab Project. Hop on over to seniorrehabproject.com where you can join the movement that's advancing care for older adults. You can join for free or become a part of the Game Changers where you can get some free gear and access to our monthly meetup. Just go to seniorrehabproject.com. I appreciate y'all, and I'll talk with you soon. But in the meantime, do not forget to stay funky.